Genetic hair loss. Genetic hair loss is one of the most common reasons women experience thinning hair. Unlike sudden hair shedding, this type usually develops slowly over many years. The hair often becomes thinner around the center part, and the scalp may become more visible over time. Genetics influence how sensitive hair follicles are to natural hormones in the body. If close family members experienced hair thinning, the chances may be higher. Although it often becomes more noticeable with age, some women begin seeing changes much earlier. Because the process is gradual, many people do not notice it until a significant amount of hair density has already been lost. Hormonal changes. Hormones play a major role in regulating the hair growth cycle. Throughout a woman's life, hormone levels naturally rise and fall during puberty, pregnancy, childbirth, and menopause. These changes can affect how long hair remains in its growth phase. When hormone levels shift suddenly, more hairs may enter the shedding phase at the same time. This often results in noticeable thinning several months later. Hormonal hair loss is different from genetic hair loss because it's often linked to a specific life event or biological transition. In many cases, hair growth improves once hormone levels become more stable. Iron deficiency. Iron is essential for carrying oxygen through the bloodstream, including to the hair follicles. When iron levels become too low, the body begins prioritizing more important organs and functions. Hair growth may slow as a result. Women are particularly vulnerable to iron deficiency because of menstrual blood loss, pregnancy, and certain dietary habits. Hair loss caused by low iron usually develops gradually rather than suddenly. Along with hair loss, some women may experience fatigue, weakness, or difficulty concentrating. Restoring healthy iron levels often improves hair growth, although recovery can take several months because hair grows slowly. Thyroid disorders. The thyroid gland controls many important processes throughout the body, including metabolism and energy use. When the thyroid becomes underactive or overactive, hair growth can be disrupted. Instead of losing hair in one area, women often notice overall thinning across the scalp. Hair may also become dry, brittle, or more difficult to manage. Thyroid-related hair loss is different because it's often accompanied by other symptoms, such as changes in weight, energy levels, or body temperature. Once thyroid function is properly managed, many women see gradual improvement in hair quality and density. Stress. Stress can have a powerful effect on the body, including the hair growth cycle. Major emotional events, serious illness, surgery, or prolonged anxiety can trigger a condition where many hair follicles enter a resting stage earlier than normal. The shedding usually begins 2 to 4 months after the stressful event, rather than immediately. This delay often makes the cause difficult to identify. Stress-related hair loss tends to affect the entire scalp, rather than creating bald patches. Fortunately, once the body recovers and stress levels decrease, hair growth often resumes naturally, although the process may take several months. Pregnancy and childbirth. Pregnancy often causes hair to appear thicker and fuller because higher hormone levels keep many hairs in the growth phase for longer than usual. However, after childbirth, those hormone levels drop rapidly. As a result, many hairs that were retained during pregnancy begin shedding within a relatively short period. This can make hair loss seem dramatic, even though it is usually temporary. New mothers often notice extra hair on brushes, pillows, or shower drains. The condition can be concerning, but most women gradually regain normal hair density as the body adjusts after pregnancy. Menopause. Menopause brings significant hormonal changes that can affect hair growth. As estrogen levels decline, hair follicles may shrink and produce finer strands. Hair may also grow more slowly than before. Many women notice widening part lines and reduced volume around the crown of the head. Menopause-related hair loss often develops gradually and may occur alongside other changes, such as dry skin or altered body composition. Because the process happens over several years, it can be difficult to recognize at first. Maintaining overall health and nutrition becomes increasingly important during this stage of life. Poor nutrition. Hair follicles require a steady supply of nutrients to remain active and healthy. Diets that lack sufficient protein, healthy fats, vitamins, or minerals can interfere with normal growth. Extreme dieting is particularly risky because the body may redirect resources towards essential organs rather than hair production. Women who lose weight very quickly sometimes notice increased shedding a few months later. Poor nutrition affects not only the amount of hair, but also its strength and appearance. Balanced nutrition supports healthier growth over the long term. Polycystic ovary syndrome. Polycystic ovary syndrome, often called PCOS, is a hormonal condition that affects many women worldwide. One of its effects is an increase in hormones that can influence hair follicles. Women with PCOS may notice thinning hair on the scalp while experiencing increased hair growth in areas such as the face or body. This pattern makes PCOS different from many other causes of hair loss. The condition often appears alongside irregular menstrual cycles, acne, or weight changes. Managing the underlying hormonal imbalance is usually the most important step in reducing hair thinning related to PCOS. Autoimmune conditions. Sometimes the body's immune system mistakenly targets healthy hair follicles. This can lead to sudden and noticeable hair loss. One common pattern involves smooth, round patches where hair disappears completely. In more severe cases, larger areas of the scalp may be affected. Autoimmune hair loss is different because it's not caused by nutrition, hormones, or styling habits. Instead, the immune system itself disrupts normal follicle activity. Hair may regrow naturally in some cases, while others require treatment to reduce immune system activity and support healthy regrowth. Medications. Certain medications can interfere with the normal hair growth cycle. Some medicines encourage more follicles to enter the shedding phase, while others affect hair growth in different ways. Treatments for blood pressure, depression, hormonal conditions, and other medical issues have all been associated with hair loss in some individuals. The effect varies from person to person. Not everyone taking the same medication will experience thinning hair. Because hair shedding often begins weeks or months after starting treatment, the connection may not be obvious. Consulting a healthcare professional can help determine whether medication is contributing to the problem. Aging. As women age, natural changes occur within the hair follicles. Growth becomes slower, individual strands become finer, and some follicles eventually stop producing hair altogether. This gradual process affects nearly everyone to some degree. Unlike sudden forms of hair loss, age-related thinning develops over many years. Hair may lose volume and appear less dense, particularly around the crown and part line. Aging also affects the texture and strength of hair. While these changes are normal part of life, maintaining good nutrition, scalp health, and overall wellness can help support healthier hair as the years pass.